Hello, my name's Joyce Gibb. Thanks for being with me today. In the season of winter, people always wonder, about frostbite and what to do about that. So there's basically a few stages of frostbite. The first one with your skin, as you probably already know, even being out in the cold, your skin can feel cold and it can just have exposure. The skin's a big barrier. It's the largest organ in the body. But just exposure to the cold air without symptoms, that's completely normal. And I would say in the winter, make sure you layer things. You might wear gloves underneath some mittens or have really warm gloves that you use for skiing so you don't get frostbite. So the basic first stage is called frostnip, and it's mild frostbite that irritates the skin. It's usually typically red on the tips of your fingers. Followed by this change of color, which is redness, and a cold feeling followed by numbness. It doesn't permanently damage the skin. So the next stage is superficial frostbite. The skin feels warm. And then as the site gets re-warmed, then there can be fluid-filled blisters that appear. And that usually happens 12 to 36 hours after re-warming. The very last stage, which you never want to get to, but potentially if someone's left out in the cold, say they fell, an adult that's older person that's fallen and they couldn't have any relief, couldn't call for anyone, they're laying there, the deep frostbite can happen. And that is when the tissue turns black. And it's probably most of the people have numbness. And then the joint that affects that area potentially can't even stop working. So they even have a harder time of getting up. But large blisters will appear in 24 to 48 hours after the rewarming. So either way, you seek medical attention. Always in the winter, don't go out in the cold whenever you're not supposed to go out in the cold, or high winds that can make the frostbite worse or the cold sensation worse. So layer. Make sure you seek attention if you have any concerns at all. So just be safe out there, and let me know if you have any questions in regards to your health, and I'd love to help you on your journey to good health. Thanks a lot. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.